Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. On January 10th, 2022, 3 vitamin D experts met for a panel discussion to provide an update on vitamin D as it impacts certain aspects of human health. And one of the topics they discussed was the role of vitamin D in cancer prevention. Very important topic. The moderator was Dr. Pam Taub, a cardiologist and professor of medicine at the University of California in San Diego. One of the panelists was Dr. Michael Holick, a professor of medicine at Boston University. He was one of the first to identify the major circulating form of vitamin D in the bloodstream, and over the past 4 decades, he's led many of the studies demonstrating the benefits of vitamin D and is responsible for putting vitamin D on the radar of many health professionals around the world. The other panelist was Dr. Joanne Manson, another famous vitamin D researcher and a professor of medicine at Harvard Medical School. She's been involved in many landmark clinical trials that have changed the course of clinical practice, including the Nurses' Health Study, the Women's Health Initiative Study, and more recently, the vitamin D and omega-3 trial. During the discussion, Dr. Michael Holick and Dr. Manson provided an important update on the studies examining vitamin D and cancer risk. They talked about the vitamin D and omega-3 trial, which is a large-scale nationwide trial in the United States that includes more than 25,000 men and women. They stated that when we looked at those who had been in the trial for at least 2 years, which is long enough for vitamin D to actually have an effect, they saw a statistically significant 25% reduction in cancer deaths in patients who were being supplemented with 2,000 IUs a day of vitamin D compared to the group that got the placebo. As they stated, the reason that this is of particular interest is that several other randomized trials have suggested that there may be a benefit of vitamin D supplementation on reducing cancer death. For example, a meta-analysis of 5 large-scale studies looking at vitamin D supplementation in cancer death showed a 13% reduction in cancer death in the group taking the vitamin D supplement versus the placebo. Now, Dr. Holick raised another very important point about how to take vitamin D. The studies we have available right now show that taking vitamin D in large doses once a week or once a month does not seem to provide protection against cancer, whereas those taking smaller doses like 2,000 IUs a day have shown a significant reduction in cancer risk. I say this because some doctors recommend that patients take large doses of vitamin D, like 50,000 IUs once a week, or larger doses like once a month, as opposed to taking it on a daily basis as a way to optimize vitamin D status. And this might be fine for individuals who are severely deficient in vitamin D. But for most people, this approach does not appear to reduce risk of cancer according to the available studies that we have so far. As Dr. Holick and Dr. Manson indicate, you want to achieve a vitamin D blood level of at least 75 nanomoles per liter. That's where 75 nanomoles per liter, which appears to be the level at which cancer prevention becomes significant. Now, this is important because in most medical circles, it's believed that a person has adequate vitamin D status once they reach 50 nanomoles per liter. So this blood level of vitamin D at 50 nanomoles per liter is probably sufficient to help support bone density and help prevent osteoporosis. But it doesn't appear to be high enough to offer protection against cancer or developing really virulent infections. So my advice is for most people is that you achieve a blood vitamin D level of between 85 and 140 nanomoles per liter. And the best way for most people to do that is by taking 1,000 to 2,000 IUs of vitamin D a day from supplements. Get your blood level of vitamin D checked to see if it's in the ideal range. In certain instances, like in some autoimmune diseases, or if you become afflicted with a severe respiratory infection, doctors may want your vitamin D levels to exceed 140. But these are exceptions to the rule. For most people, you want to get your blood level between 85 and 140 nanomoles per liter. Usually 1,000 to 2,000 IUs a day will do that. So I hope this was helpful. I've included the reference for this panel discussion in the text below. Thanks for watching, and I'll see you next time.